Good morning, students. So, let us look at the next important topic, and this topic covers drugs, adolescence, and drugs alcohol abuse. First, let us talk about drugs. So, what are drugs? Talking about the drugs, so drugs are those substances that change a person's physical or mental state, right? Actually, a drug is any chemical you take that affect the way your body works, right? Means it totally changes the way of working of the body, which cause the change in physical state as well as the mental state. And the majority of drugs are used to treat the medical conditions, right? Whether it is the physical or the mental state. So in that way we can say that a drug is any chemical substance that totally change the way of working of the body, which cause the change in physical state as well as the mental state. Talking about the sources. Now let us also talk about the sources of drugs. So the sources of drugs are of 6 types, right? Drugs are obtained from 6 major sources. What are those 6 sources? Plant sources, animal sources, mineral or earth sources, semi-synthetic sources, microbiological sources, and recombinant DNA technology. When we talk about the plant resources, so plant sources is the oldest source of a drug. You know that most of the drug in ancient time were derived from plants. Almost all part of the plant are used. That is leaves का अगर example बात करते हैं तो eucalyptus gives oil which is used as the medicine. Flower की बात करते हैं तो poppy gives morphine. Fruit की बात करते हैं तो calabar beans which is used in the stomach disease. Seed की बात करते हैं तो मेथी which is also used as the medicine. Bark की बात करते हैं तो दालचीनी which is used as the spices as well, right? So the main source of the plant and the oldest or ancient source of the drug is the plant source. The next category is the animal source. So animal source like pancreas which gives insulin used in the diabetes, thyroid which gives thyroxine used as the metabolic medicine. Third one is the mineral or earth resources. इसमें हमारी दोनों कैटेगरीज आ जाती हैं, मेटालिक और नॉन मेटालिक सोर्सेज. मेटालिक की बात करते हैं तो आयरन जो एनीमिया में यूज़ होता है, जिंक एक्जिमा में यूज़ होता है. नॉन मेटालिक की बात करते हैं तो फ्लोरीन डेंटल कैरीज में यूज़ होता है, बोरेक्स एंटीसेप्टिक में यूज़ होता है, राइट? सो इन दैट वे वी कैन ऑब्टेन ड्रग्स फ्रॉम द मिनरल और अर्थ रिसोर्सेज ऑल्सो. The next category is the semi-synthetic resources or synthetic sources. Now children, when nucleus of the drug obtained from the natural resource retain but chemical structure altered, so that is known as semi-synthetic sources. और synthetic source क्या होती है? When nucleus of the drug is in the natural state and its chemical structure altered from the synthetic way, right? So this is known as semi-synthetic source and synthetic source. Next category is the microbiological sources जैसे कि penicillium, actinobacteria, right? When we obtained drug from the microbial organisms, right? Next is the recombinant DNA technology. It involves cleavage of DNA by the enzyme restriction, that is like the endonuclease enzyme, right? So talking about the advantage, so huge amount of drug can obtained, right? And drugs are obtained in the pure form actually, right? It is less antigenic, right? So in sum, if we talk about, so mainly drug obtained from the flowering plants and fungi, right? So talking about more, the drugs which are commonly abused are opioid, cannabinoid, Coca alkaloid, hallucinogens and tobacco. And we will start our discussion with the opioids. These are actually pain relievers. Sometimes you have pain, maybe in your hand, right? What do? You take painkillers. they reduce the intensity of pain. How do they reduce intensity of pain? Children, pain is still by the change, the area of your brain which actually give your perceptions of pain. Some changes takes place on that portion of brain, right? So in that way they act as the painkillers. Talking about the opioids, so opioids are the medications that relieves pain, right? These drugs suppress the brain activity and relieve pain. They are properly known as painkiller, जिन्हें हम analgesic effect भी कहते हैं, and these have narcotic effect also. Like they are psychoactive compound which sleep inducing properties, right? Narcotic, narco means to make numb. They also have sedative and astringent effect. Sedative means a drug that calm the patient, right? Astringent means contraction of tissue, control of bleeding, right? They also used for cough relief, for the treatment of vomiting and diarrhea, right? Now children, these opioid includes heroin. Talking about the heroin, they commonly called as smack or brown sugar. It is white crystalline odourless bitter compound. It is obtained by acetylation of morphine, right? Chemically, heroin is a diacetyl morphine. Now coming to the morphine. Morphine extracted from the latex of poppy plant, that is Papaver somniferum, which is depicted in the figure. They are generally taken by snorting and injections. Snorting means by the nose, nasal insufflation, right? Actually, it slows down body function and depress nervous system. So it is an effective sedative and painkiller used by the patients who underwent surgery, right? Now coming to next category, that is cannabinoid. So children, these are the group of chemicals which interact with the cannabinoid receptor in the brain, right? And it is involved in the variety of physiological processes like mood, memory, appetite, right? And natural cannabinoid are obtained from the plant Cannabis sativa, right? That is depicted in the picture. Leaves, flower top and raisins of cannabis are used in the combination in production of marijuana, hashish, charas and ganja. These drugs are taken by inhalation and oral ingestion and affect the cardiovascular system of our body, right? Now the next category is Coca alkaloid, which is commonly known as cocaine. Children, it is obtained from Coca plant, that is Erythroxylum Coca. It is the native to South America. It is commonly called as coke, crack, and it is taken by snoring. Cocaine interferes with the transport of dopamine, which is a neurotransmitter actually. It stimulates the nervous system and produces a sense of euphoria and energy. Its excessive doses causes hallucination. Children, as I just mentioned that it stimulates the nervous system and produces a sense of euphoria. Do you know what is euphoria? Euphoria, medically recognized as mental and emotional condition in which person experience intense feeling of well-being, happiness, खुशी का एहसास होता है, and energy और energy भी feel होती है, right? So this category of drug actually gives the feeling of euphoria and energy. लेकिन अगर इसकी excessive dose हो जाए तो it causes hallucination. Do you know what is hallucination? It is the perception in the absence of external stimulus. किसी चीज के ना होते हुए भी उसके होने का एहसास. That is known as hallucination. The another category is the hallucinogens. Children, these are obtained from the plant like Atropa belladonna and Dhatura. Lysergic and diethylamide is derived from the fungus, that is Claviceps purpurea. These drugs have effect on the cerebrum and sense organ also, and called psychedelic drugs, which have effect on the feelings, emotions, perceptions and thoughts. Normally these drugs are given to the patient suffering from depression, insomnia and mental illness. So in that condition the hallucinogens are given. The another category is the tobacco. Tobacco is obtained from tobacco plant, which can be smoked and chewed. Tobacco has nicotine, which stimulates the adrenal gland to release adrenaline and noradrenaline, which actually increase the blood pressure and heart rate. The tobacco chewing has some adverse effect on the health, right? So talking about the effects on the health, so tobacco can induce lung cancer, cancer of urinary bladder and throat, bronchitis, coronary heart disease, gastric ulcer, so importantly oral cancer. These are some of the adversely effect of tobacco on the health. In children, smoking increase carbon monoxide content in the blood and reduce the concentration of hemoglobin bound oxygen. Thus it also lead to the oxygen deficiency in the body, right? And addicted people requires counseling and medical help to get rid of the habit, right? Now let us talk about the adolescence and drug alcohol abuses. Children, talking about the adolescence. Adolescence refer to a period between 12 to 18 years. Bridging, it is actually the bridge between the childhood and the adulthood, right? So the age between the childhood and adulthood is known as adolescence, and the synonym of adolescence is known as puberty. It is a very vulnerable phase of mental and psychological development of an individual, right? Vulnerable means unprotected, and in this age use of drug or alcohol occur out of curiosity and experimentation, which later turns to the addiction. इस puberty की age में curiosity होती है कि आखिर क्या है इसमें, right? So due to the curiosity and experimentation, the use of alcohols and drugs occur in this age. लेकिन बाद में क्या होता है? It turns addiction. Drugs and alcohol, when taken for the purpose other than the medicine or taken in amount of or the frequencies, disturb the physical, physiological and psychological functions. It is known as drug abuse or alcohol abuse, right? अगर medication के लिए लिया जा रहा है, then it's okay. लेकिन if the drugs and the alcohol is used other than the purpose of medication, right? तो क्या होता है? It disturbs the physical, physiological and psychological functions of our body. तो ये क्या कहलाता है? Drug abuse or alcohol abuse. Talking about the addiction and dependence. Children, there are two basic parameters which force the persons to become addicted to one or more forms of the drug, right? Addiction क्या है? Addiction, it is a physiological attachment to certain effect, such as euphoria associated with drug and alcohol. It makes the person to take up drug on the regular basis, even when it is not needed, right? Addiction also leads to take up of higher doses of drug, and the repeated use of the drug and alcohol increases the tolerance level of the receptor present in our body, right? Euphoria, happiness के लिए लोग drugs या alcohol का use करते हैं, and they take on the regular basis. ज़रूरत ना भी हो तब भी वो regular basis पर इनको consume करते हैं. And the addiction also lead to the take up of higher doses of drug, right? और alcohol और drugs के repeated use से it increase the tolerance level of the receptor. हमारी बॉडी के रिसेप्टर का टॉलरेंस लेवल इंक्रीज करता है, तो हमें हर बार ज़्यादा अमाउंट में इन चीज़ों की रिक्वायरमेंट होती है. एज अ रिजल्ट द रिसेप्टर रिस्पॉन्ड ओनली टू द हायर डोजेज ऑफ ड्रग एंड एल्कोहल, लीडिंग टू मोर एडिक्शन, राइट? Talking about the dependence, it is the tendency of a person to show unpleasant or uneasy withdrawal syndromes if the dose of alcohol or drug is discontinued. अगर कभी भी इन चीज़ों की discontinuity होती है, withdrawal of the alcohol या withdrawal of the drug होता है, it causes unpleasant और uneasy syndrome, right? जैसे कि anxiety, shakiness, sweating, nausea. तो मतलब you cannot survive without these things. So this is known as dependence, right? Now talking about the reasons for taking drugs and alcohol. So adolescents take drugs and alcohol due to social pressure, curiosity, to avoid depression, to avoid stress, to avoid frustration, to overcome with the hardships, avoid unsupported family structure. So because of these conditions, adolescent people are used to take drug. Talking about the effects of drug and alcohol. So there are two categories, immediate effect and far-reaching implications. Talking about the immediate effects and far-reaching implications, so recklessness behavior. Recklessness behavior means careless behavior. Vandalism, violence, respiratory and heart failure, hemorrhage. Excessive doses may lead to coma and death too. Aggressive behavior, depression, fatigue, withdrawal and isolation, change in sleeping pattern, fluctuation in weight, drop in academic performance of the student. So these are some of the immediate effect of drugs and alcohol. अब अगर मैं बात करती हूँ far reaching implications. So far reaching implication includes habit of stealing or not getting money to buy drugs and alcohol. जब ड्रग और अल्कोहल खरीदने के लिए पैसे नहीं होता तो चोरी करना, that is the far reaching implication of effect of the drug and alcohol. High risk of infection like AIDS and hepatitis B. Sports person take up certain drugs to enhance the performance, and these drugs increase the muscle strength and bulk, and these anabolic steroid have many side effects, right? Talking in the females, it cause masculizations, increase aggressiveness, mood swing, depression and all. In the males, it cause acne, increase aggressiveness, mood swings, depression, reduction of size of the testicles, decreased sperm production, potential for the kidney and liver dysfunction. So these are some of the far-reaching implication of these drugs and alcohol, right? Now children, talking about the prevention and control. So prevention is always better than cure, especially in the case of drugs and alcohol abuse. People get addicted to drugs and alcohol at the very young age. Therefore, the parent and teacher have a very significant role in that way. Some of the measures that will help in preventing the problem of drug and alcohol abuse are avoid undue peer pressure. बच्चों के लिए पेरेंट्स को भी ये समझना चाहिए कि बच्चे पे एक्स्ट्रा और अनड्यू प्रेशर ना दिया जाए, right? Parents must understand the abilities and personality type of the child, right? Education and counseling. Parents and teachers should educate and counsel the child to face difficult situation in the life. बच्चे को सिखाना चाहिए कि किस तरीके से आप अपनी लाइफ की डिफ़िकल्ट सिचुएशंस को फेस करें. Seeking help from parents and peers. In case of any academic or emotional problem, advice and guidance should be sought out from the parent or trusted friend, right? बजाय इसके कि हम प्रॉब्लम को और क्रिएट करें और बढ़ावा दें, the problem is solving by the parent, teachers and friends. Looking for the danger sign. Danger sign must be brought in light and must be told to parent and teacher if they find someone using drugs and alcohol. For example, अगर आपका कोई फ्रेंड है और वो किसी भी टेंशन में या डिप्रेशन में है और आपको उसके पास कोई साइंस ऐसे मिल रहे हैं कि he started smoking, he started drinking, तो आपको ये बात छुपानी नहीं है. आपको उसके पेरेंट्स से, टीचर से बात करनी है ताकि प्रॉब्लम सॉर्ट आउट हो सके. So you have to looking for the danger sign, right? Seeking professional and medical help. It is the last and very effective solution कि किसी प्रोफेशनल काउंसलर या मेडिकल हेल्प का सहारा लें. अगर कोई बच्चा किसी प्रॉब्लम में है ड्रग और अल्कोहल एडिक्ट होता जा रहा है तो आपको किसी प्रोफेशनल की हेल्प लेना ज़रूरी है, राइट? सो दीज आर सम ऑफ द way to prevent and to control the alcohol and drug abuse. So I hope whatever we have discussed today you got it. So this chapter is completed. Very soon I will forward the assignment of this chapter, and in the next video we will meet with the new chapter. Till then, have a nice day and thank you. And children, your task is to revise and learn today's topic. Thank you.